I'm Dr. Raymond Douglas. I'm an oculoplastic surgeon, an orbital surgeon here in Los Angeles. And today, Dr. Babak Larian is going to be joining us in our Facebook and event. And what we'd like to talk about is a little bit of background of thyroid eye disease and how the thyroid relates to that disease. Dr. Larian, I'll let you tell everyone a little bit about your background, but I know that you are an expert in removal of the thyroid, and you
Yes.
do it as well as anyone in the world. And so I'll let you tell everyone a little bit about what you do in your day to day.
All right. Good morning. Um, my name is Babak Larian. I'm a head neck surgeon, and so my field of specialty is tumors in the head neck areas. And an overabundance of these tumors occur in the thyroid gland. So thyroid surgery is the mainstay of what I've been doing. And over the years, in concentrating and focusing on the thyroid gland and the parathyroid gland, I've come to treat a lot of patients with Graves' disease and manage their issues and problems and see how the disease progresses and how it affects other organs like the eyes. And so thyroid surgery is something that's integral to my practice.
Great. And I see a lot of patients with thyroid eye disease, and my patients often have very common questions pertaining to the thyroid function, what they should do about their thyroid. And I just wanted to ask you a few questions and help guide our patients who are listening. One is, what common tests do you order for thyroid function? And could you tell us a little bit about what they mean? A lot of patients ask me, and give me four numbers, and they say, well, what does all this mean?
Okay.
Can you kind of distill down what a TSH is and a free T3 so that patients understand a little bit about what their numbers mean?
Absolutely. So TSH is a hormone produced from a tiny little gland in the brain, a portion of the pituitary gland. And this hormone comes from your brain and goes to your thyroid gland and instructs the thyroid to produce thyroid hormone. Once the thyroid hormone gets released into the bloodstream, it courses through the blood and gets back into the brain. And that gland in the brain, the pituitary, measures the amount of thyroid hormone in the bloodstream, decides if it's adequate or not. If it's not adequate, it produces TSH, which is thyroid stimulating hormone, to stimulate the thyroid gland to produce more hormone. So the relationship is dynamic, and it's between that pituitary gland and the thyroid gland. And they have a very close bond with each other. Any small concentration change in your thyroid hormone level is responded to by the pituitary gland to adjust the level in the blood. The pituitary looks at the free T3. The free T3 and free T4, which are the two forms of thyroid hormones, are the active components of the thyroid hormone, right? So the thyroid hormone can be bound to stuff, to proteins in the bloodstream, or it can be free floating. It's that free portion that actually does the work. It's able to get into other parts and attach to other things. The parts that are not free don't do as much work. They're just in the bloodstream, and they can separate off and then go on to do their work.
Yeah. And patients often ask me, when they have the eye disease, does the thyroid function or does their thyroid control in any way affect their eye disease? And it does for in a certain extent. What I always tell patients is that the first goal is to stabilize their thyroid function in one way or another so that their eye disease can at least stabilize, hopefully stabilize during that period of time.
Right. And the mainstay, obviously, when the first patients come in, is to try to use medications because they can work immediately until you figure out the behavior of the disease. You understand if the disease is going to be able to be managed with medications, if you can tolerate the medication. And if so, then that gives you the luxury of time to investigate and figure out how the disease is going to behave despite the medication and what other steps are appropriate that you can, investigate and figure out what's appropriate for you.
We're going to have a few other segments coming up about thyroid hormone, thyroid antibodies. Please stay tuned.
Thank you.